Welcome to my YouTube channel on substance misuse. Hi, my name is Sonia Penstead and I've had 20 years experience as a mental health nurse and addictions counsellor and a position as a clinical nurse consultant working for Drug and Alcohol Services in South Australia. Drug and Alcohol Services South Australia is a peak research body of professionals who specialise in the area of addictions. I worked as a rehabilitation nurse in detox and gave advice to clients and GPs around the home detox regime and have had the privilege of being the consultant covering a large rural area. I have counselled thousands of clients ranging from adolescents to people in their old age and working from a number of frameworks like motivational interviewing, cognitive behavioural therapy, narrative therapy, client-centred therapy, mindfulness and more. I have a Christian faith, and although I don't give spiritual advice, many of my clients also had a Christian faith and would ask for biblically based advice. The YouTube channel is for anyone who is struggling with addiction from all walks of life and for someone with a coexisting mental health issue as well. Also for anyone who's wanting more information and support around caring for someone with an addiction. I have a specific section for people of faith. So let's get started. What is addiction? Well, the short answer is this. Addiction is a complex and chronic psychological and physiological condition characterised by a compulsive need for and use of a substance or engagement in behaviour despite negative consequences. It often involves a loss of control, increased tolerance, withdrawal symptoms, and a preoccupation with the substance or behaviour. What is substance abuse, or is commonly known as substance misuse? Substance misuse or abuse specifically refers to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. It involves the consumption of these substances in ways that are detrimental to physical and mental health and can lead to a pattern of addiction. Substance abuse can result in a range of social, legal and health problems. What are some of the risk factors for substance abuse? Substance abuse is a complex issue influenced by a combination of factors. Risk factors can increase the likelihood of someone developing a substance abuse problem. These risk factors can be categorised into various domains. Number 1. Biological factors. Genetics. A family history of substance abuse or addiction can increase one's susceptibility. Gender. Some substances may have different effects or risks for males or females. Number 2. Environmental factors. Access. Easy access to drugs or alcohol can facilitate substance abuse. Stressful life events, trauma, abuse, or major life stresses can lead to substance abuse as a coping mechanism. Number 3. Family factors. Family history. A family environment where substance abuse is normalised or prevalent can increase the risk. Parental substance abuse. Growing up in a household with substance abusing parents can also contribute. Lack of parental support. A lack of emotional support or inconsistent discipline can be a risk factor. Number 4. Psychological factors. Low self-esteem. Individuals with low self-esteem may use substances to boost their confidence or self-worth. Impulsivity. Impulsive individuals may be more likely to experiment with drugs or alcohol. Sensation seeking. A desire for novel or intense experiences can drive substance experimentation. Socio-economic factors. Poverty, limited access to resources and opportunities can increase the risk. Unemployment, lack of employment or finance stability can contribute. Education, lower levels of education can be associated with substance abuse. Number 6, cultural and peer influences. Cultural acceptance. Cultural norms and beliefs regarding substance use can influence behaviour. Media and advertising. Media portrayals and advertising of substance use can shape perceptions. Number 7, early exposure. Early experimentation with substances during adolescence can increase the risk of developing a substance abuse disorder later in life. Number 8, lack of coping skills. Inability to cope with stress, emotional difficulties or life challenges in healthy ways can lead to self-medication with substances. What are the main countries where substance abuse occurs and what substances are more prevalent in which countries? Substance abuse is a global issue and the prevalence of specific substances can vary widely from one country to another. In Australia, like in many other countries, several substances are commonly abused. Here are some insights into substance abuse in Australia. Number 1, alcohol. Alcohol is one of the most commonly abused substances in Australia. It is legal and widely available. The country has a well-documented culture of social drinking and excessive alcohol consumption is a concern. Harmful drinking patterns, binge drinking and alcohol-related health issues are prevalent. Number 2, tobacco. While the rates of smoking have been decreasing in Australia due to strict tobacco control measures, it remains a significant public health issue. Tobacco use is a leading cause of preventable diseases and deaths in the country. Number 3, cannabis. Cannabis is one of the most commonly used illicit drugs in Australia. It is often used recreationally and its use has been a subject of debate regarding legalisation for medicinal purposes. Number 4, methamphetamine or ice. Methamphetamine abuse, particularly in the crystalline form known as ice, has been a growing concern in Australia. Its use can lead to severe health and social problems. Number 5, prescription medications. The misuse of prescription medication, particularly opioids and benzodiazepines, is a rising issue in Australia. People may obtain these drugs through doctor shopping or by other means. Number 6, ecstasy or MDMA. These synthetic drugs are often used recreationally, particularly among young adults attending festivals and parties. Number 7, heroin. While heroin use has declined in Australia compared to previous decades, it is still a concern in some communities. Australia has implemented various harm reduction strategies and drug education programs to address substance abuse. The government has also tightened regulations on the prescriptions and distribution of some medications to combat misuse. It's important to note that substance abuse trends can change over time due to shifts in drug availability, law enforcement efforts and public health interventions. The prevalence of specific substances may also vary by region within Australia. Additionally, addressing substance abuse requires a comprehensive approach involving prevention, treatment, and support services. What are the main drugs of concern in the USA? The main drugs of concerns in the United States can vary over time, and they are typically assessed based on factors such as prevalence of use, health consequences, and societal impact. While both the United States and Australia face substance abuse issues, the specific drugs of concerns and their relative rankings may differ. Here are some of the primary drugs of concerns in the United States, along with percentages where applicable. Number 1. Opioids, including prescription painkillers and heroin. In the US, opioids have been a major concern, with a significant increase in opioid-related overdoses and deaths in recent years. In 2020, there were over 93,000 drug overdose deaths, and opioids were involved in the majority of them, accounting for more than 69,000 deaths. That constitutes a significant concern, particularly prescription opioids like oxycodone and illicit opioids like fentanyl. Number 2. Methamphetamine. Methamphetamine abuse has been on the rise in certain regions of the United States. In 2020, methamphetamine overdose deaths increased by nearly 35%. Number 3. Cocaine. Cocaine remains a concern, especially in urban areas. Number 4. Marijuana. While marijuana has been legalised for medicinal or recreational use in many US states, concerns remain regarding the impact on public health, particularly among young people. Number 5. Synthetic drugs, e.g. synthetic cannabinoids, bath salts. The use of synthetic drugs, sometimes referred to as designer drugs, has posed challenges due to their unpredictability and their health risks. Number 6. Benzodiazepines. The misuse of prescription benzodiazepines such as Xanax and Valium has been a concern. Number 7. Hallucinogens. The misuse of hallucinogens like LSD and psilocybin containing mushrooms remains an issue. Number 8. Alcohol. While alcohol is legal and widely consumed in the US, it continues to be a significant public health concern. Alcohol-related problems include alcohol use disorders, drunk driving, and associated health issues. Drug trends in Europe can vary from country to country and may change over time. However, as from our last knowledge update in September 2021, here are some of the main drugs of concern in Europe, generally ordered by concern. Number 1. Opioids, including heroin. Opioids, particularly heroin, have been a major concern in parts of Europe, contributing to drug-related deaths. In some countries, like Estonia and Sweden, opioid-related mortality rates are relatively high compared to other European nations. Number 2. Synthetic opioids such as fentanyl. The emergence of synthetic opioids like fentanyl and its analogues has posed a significant risk across Europe. These potent substances can be added to other drugs, increasing the risk of overdoses. Number 3. Cocaine. Cocaine abuse has been on the rise in several European countries, with increases availability and use, particularly in urban areas. Number 4. Cannabis. While cannabis is one of the most widely used illicit drugs in Europe, It is often considered a lower concern than some of the other substances due to lower associated health risks. Number 5. MDMA, ecstasy and other synthetic drugs. MDMA, as well as other synthetic drugs like synthetic cannabinoids and legal highs, have been a concern due to their unpredictable effects and potential health risks. Number 6. Methamphetamine. Methamphetamine use, while lower in Europe compared to some other regions, has been on the rise in certain countries, including the Czech Republic. Number 7. New psychoactive substances, NPS. The constantly changing landscape of NPS, also known as designer drugs or legal highs, has presented regulatory challenges and health risks in Europe. Number 8. Prescription medications. The misuse of prescription medications, especially opioids and benzodiazepines, is a concern in some European countries. Number 9. Alcohol. Alcohol is widely consumed across Europe and continues to be a significant public health concern due to related health issues and social problems. The European Monitoring Centre for Drugs and Drug Addiction, EMCDDA, regularly publishes reports and data on drug trends in Europe, providing up-to-date information on drug-related issues in the region. So, shall we have a closer look at the drugs? It is important to note that specific statistics on drug use, accessibility, manufacturing, demographics, addiction potential, and treatment outcomes can vary by country and region. Additionally, data can change over time due to shifts in drug markets and governmental policies. I'll provide a general overview of each drug category as of my last knowledge update in September 21, but I recommend referring to the latest reports and studies for the most up-to-date information for specific regions.